Hi everyone, welcome back to my YouTube channel. Today we are going to talk about openings in Norma Basalis. As you can see here at the side we have Norma Basalis. So let's talk about what are the openings that are present in Norma Basalis. We will start the topic with introduction. Like Norma Basalis, that is also called its inferior view of skull, is packed with anatomical gateways. These foramina and canals allow the passage of cranial nerves, arteries, and veins and other essential structures that are present between the brain and rest of body. The opening can be regionally categorized into anterior, that is palatal region, middle, that is central region, and posterior, that is also called as occipital zone or occipital region. First, we will talk about anterior opening that are present in anterior one third of normal basalis. First, we have an incisive foramen that is found just behind the upper central incisor. It transmits the nasopalatine nerve and sphenopalatine vessel into the anterior part of hard palate. Second anterior opening is greater palatine foramen that is located medial to the last molar on the posterior hard palate. It allows passage of greater palatine nerve and vessel which supply the hard palate mucosa. Third is lesser palatine foramina that is positioned posterior to the greater foramen along the pyramidal process of paraline bone. It conveys a lesser palatine nerve and vessel to the soft palate and uvula. Now let's talk about openings that are present in middle third of the normal basalis. They include foramen ovale, that is oval-shaped opening in the greater wing of sphenoid bone. It transmits the mandibular nerve, excessive meningeal artery, and sometimes the lesser petrosal nerve. Second opening in the middle third is the foramen spinosum, that is just posterior and lateral to the foramen ovale. It carries the middle meningeal artery and vein and the meningeal branch of V3. Next is foramen lacerum, that is a jagged opening between sphenoid and temporal bone filled with cartilage in live. Although it does not transmit major structures directly, the internal carotid artery passes over it into the cranial cavity. Further in middle third we have carotid canal that is located in the petrous part of temporal bone. It guides the internal carotid artery and accompanying sympathetic plexus into the cranial cavity. Next is stylomastoid foramen that is present between the styloid and mastoid process of temporal bone. It exits for facial nerve and entry point for stylomastoid artery. Next is petrotympanic fissure, that is a narrow slit anterior to the external acoustic meatus. That is pathway for the chorda tympani nerve, that is branch of cranial nerve number 7 to leave the skull. Next is external acoustic meatus, that is the canal that leads from the outer ear to the eardrum. It terminates internally to the tympanic membrane. Now let's talk about what are the openings present in posterior third of the norma basalis. They include foramen magnum, that is the most prominent and centrally located opening at the base of skull. It allows passage of spinal cord, vertebral arteries, meninges, spinal cord, and cranial nerve number 11, and accompanying veins and ligaments also pass through it. Next is jugular foramen, that lies between the temporal and occipital bone. It transmits the internal jugular vein and cranial nerves like 9th, 10th, and 11th. Ninth cranial nerve is glossopharyngeal nerve, 10th cranial nerve is vagus nerve, and 11th cranial nerve is accessory nerve. In further, we have an posterior opening hypoglossal canal that is situated laterally to the foramen magnum within the occipital condyle. It is passageway for the hypoglossal nerve, that is cranial nerve number 12. Next is condylar canal if present, because in some people it is not present. It is present posterior to the occipital condyles. They transmit the emissary vein that connect the sigmoid sinus with external veins. Now let's talk about conclusion of this lecture video. The base of skull is a masterpiece of intricate passageways, each one precisely positioned to ensure safe, efficient communication between the brain and the rest of the body. Whether it's for nerve exit, vascular flow, or surgical access, knowing the layout of these openings is essential for students, surgeons, and clinical professions alike. So this was all about Norma Basalis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.